Hello, my name is Dr. Dewan S. Raja. Today I will discuss about the cervical part of the sympathetic trunk. The sympathetic trunk are present paravertebrally. It contains multiple ganglion. It extends from the base of the skull to the coccyx. We have two sympathetic trunk. They are present by the side of the vertebral column. So in the cervical part of the sympathetic trunk, we have three cervical sympathetic ganglions. These are the superior cervical sympathetic ganglion, middle cervical sympathetic ganglion, inferior cervical sympathetic ganglion. The superior cervical sympathetic ganglion, it is located opposite the second and third cervical vertebral body. This is the superior cervical sympathetic ganglion. Okay, so it is located against the body of the second and third cervical vertebra. And the middle cervical sympathetic ganglion, this is smaller and it is located opposite the cervical vertebra C6. Inferior cervical sympathetic ganglion is situated between the transverse process of C7 and the neck of the first rib. This is the inferior cervical sympathetic ganglion. Middle cervical sympathetic ganglion, superior cervical sympathetic ganglion. It extends from the base of the skull, going down. It is by the side of the vertebral column. It is not inside the vertebral canal. And this is the trunk. It is containing the ganglion. The upper ganglion, superior cervical ganglion, it is fusiform and elongated and the largest. These are small. Sometimes the inferior cervical sympathetic ganglion may unite with the first thoracic ganglion and produce the cervicothoracic ganglion or stellate ganglion. Okay, so you have to remember a few things. We have three pairs of cervical sympathetic ganglion: superior, middle, and inferior cervical sympathetic ganglion. We have 7 cervical vertebrae. We have 8 pairs of cervical spinal nerve. Okay, we have 7 cervical vertebrae, but we have 8 pairs of cervical spinal nerve. We have in total 31 pairs of spinal nerves. And number of ganglion in the sympathetic trunk is around 23 to 26. It varies from person to person. Okay, so spinal nerve 31, but the number of sympathetic ganglion is 23 to 26. The sympathetic trunk extends paravertebrally. They are present by the side of the vertebral column from the base of the skull to the coccyx, and two ganglion come together in front of the coccyx lower part and it forms the ganglion impar. So ganglion impar is the lower end of the two sympathetic trunk. They come together by the side of the vertebral column and they unite in the ganglion impar. Okay, so we are looking at the superior cervical sympathetic ganglion, middle cervical sympathetic ganglion, inferior cervical sympathetic ganglion. Okay, in this location, there is no white rami communicants because the preganglionic fiber are coming from the upper thoracic segment of the spinal cord fiber. So the postganglionic fiber goes to the eye, inside the iris, to the dilator pupillae, it dilates the pupil. It goes to the tarsal gland in the eyelid. Okay, it also goes to the lacrimal gland. The lacrimal gland gets sympathetic innervation from the superior cervical sympathetic ganglion. This is the postganglionic fiber. The superior cervical sympathetic ganglion also give connection to the submandibular and sublingual salivary gland and the parotid gland. Okay, from superior cervical sympathetic ganglion, we are also getting contribution to the cardiac plexus. Okay, so for lacrimation, we have to know that that is parasympathetic, and sympathetic is vasoconstriction. Okay, we got that. Now here the middle cervical sympathetic ganglion, it also contribute to the heart. Okay, and the inferior cervical sympathetic ganglion, that also contribute to the heart. So heart is getting contribution from multiple sources: superior, middle, inferior cervical sympathetic ganglion, plus the upper thoracic sympathetic ganglion. Lungs is also getting contribution from the upper thoracic sympathetic ganglion, and these are coming out from the lateral gray horn of the spinal cord. Okay, we got that. Now we got the some notes here. Now continue from here. Cervical part of sympathetic trunk. Okay, we have found the right and left sympathetic trunk on each side of the vertebral column, located behind the carotid sheath. So its relationship is that it is behind the carotid sheath, and carotid sheath contains the common carotid artery, the vagus nerve, the internal carotid artery. So sympathetic chain of ganglion is behind it, but in front of the prevertebral fascia. Behind the prevertebral fascia, we have muscles. There are no white rami communicants in the neck. The preganglionic fibers comes out of the lateral gray horn of T1 to T4 of spinal cord, maybe from T5 also. So superior cervical sympathetic ganglion, upper end, we call it internal carotid artery. It is going inside the cranial cavity over the internal carotid artery. Okay, this is the internal carotid nerve. Okay, and we have also some branches follow the external carotid artery over this artery are just the passageway. So it is over the artery. So on the artery, it reaches to the other organs. Okay, like to the eye, to the salivary gland, to the parotid gland. Okay, so by means of that, it goes over the arteries to reach the target organ. Located behind the carotid sheath in front of the prevertebral fascia, there are no white rami communicants in the neck. Okay, but we have gray rami communicants. Okay, the preganglionic fibers comes out of the lateral gray horn of T1 to T4 of the spinal cord, maybe from T5 also. So have superior cervical sympathetic ganglion, middle cervical sympathetic ganglion. It is connected to the inferior cervical sympathetic ganglion. Okay, by fibers passing around the vertebral artery, and another big branch coming from the middle cervical sympathetic ganglion, turning around the subclavian artery. This is called Ansa Subclavia, and it is connecting, and subclavia connecting the middle cervical sympathetic ganglion to the inferior cervical sympathetic ganglion, turning around the subclavian artery. Okay, we got that. Now, branches of cervical sympathetic ganglia, we have arterial branches. Okay, it passes over the arteries like that of the external internal carotid arteries to reach the target organ. It passes over the tunica adventitia of the blood vessels. Middle cervical sympathetic ganglion, it passes along the inferior thyroid artery. Okay, so, and the inferior cervical sympathetic ganglion, it passes to the subclavian artery and the vertebral artery. Gray rami communicants, superior cervical sympathetic ganglion along first to fourth cervical spinal nerve. Here middle cervical sympathetic ganglion, fifth and sixth cervical spinal nerve. Inferior cervical sympathetic ganglion, 7 to 8 cervical spinal nerve. Ideally, the idea is that during development, we have 4 ganglion fused to form one large superior cervical sympathetic ganglion. 2 small fifth and sixth ganglion fused to form middle cervical sympathetic ganglion. Like 7 to 8 small ganglions unite to form the inferior cervical sympathetic ganglion. The superior cervical sympathetic ganglion fiber also follows the cranial nerve, 9th, 10th, 11th, and 12th cranial nerves. Visceral branches, it supplies the pharynx and the cardiac branches. Thyroid and cardiac branches going through the middle cervical sympathetic ganglion, inferior cervical sympathetic ganglion along with the stellate ganglion goes to the heart and the lung. Okay, we got the branches, gray communicants, arterial branches, and its passage through the cranial nerves to go to the ganglion and supply to the structure supplied by the ganglions. Okay, sympathetic innervation of the effector organ by the cervical part of sympathetic trunk. Okay, tarsal muscle, also called molar muscle in the upper eyelid, preganglionic spinal level C8T1 to T2, postganglionic cell, superior cervical sympathetic ganglion, and it causes eyelid elevation. So if this is paralyzed, there will be partial ptosis, drooping of the eyelid partially. Okay, iris muscle getting innervation from superior cervical sympathetic ganglion. Okay, there will be pupillary dilation. Okay, we call it mydriasis. So if this is damaged, then we'll get meiosis, constriction of the pupil. Salivary gland, there will be sick salivation due to sympathetic stimulation. Okay, lungs, the sympathetic innervation causes bronchodilation and the vasoconstriction. Heart, it getting innervation from the middle and stellate and also from superior cervical sympathetic ganglion. It will cause increased heart rate, heart force of contraction, atrioventricular conductance, and increased cardiac output. Okay. Now we'll draw the surface anatomy of the cervical part of sympathetic trunk. Point for outlining. Okay. Number 1, a point on the posterior border of the condyle of the mandible. Okay. So suppose this is the area here. Second point on the sternoclavicular joint. Point is here. And if we draw these two lines, we'll get the sympathetic chain of ganglion, sympathetic trunk, and upper part we have the superior cervical sympathetic ganglion. We'll get small middle cervical sympathetic ganglion, and we'll get inferior cervical sympathetic ganglion. Okay, we can draw in that way. The superior cervical sympathetic ganglion usually fusiform and large size. Okay, large size, fusiform, and it has multiple branches. This also has branches. Okay, they have also branches. Okay, we go to there. Now I'll go to the clinical anatomy of the cervical part of sympathetic trunk. Okay, if you go there, we will get the Horner syndrome. Okay, what is Horner syndrome? When there is lack of sympathetic innervation to the head and neck, we'll get Horner syndrome. In Horner syndrome, what are the features? Ptosis due to paralysis of the superior tarsal muscle or molar muscle. Meiosis, people will be constricted in comparison to the normal side. Anhidrosis, this part will be dry, no sweating because it is not getting sympathetic innervation. In ophthalmos, apparently eyeball seems to be pushed back. Maybe sympathetic has some role to provide nutrition to the areolar tissue in the orbit. Okay, we may have in ophthalmos, eyeball seems to be pushed back. Anisocoria, two pupils are different size. So these are the features of Horner syndrome. It may be due to trauma in the neck, in the sympathetic passage to the head and neck. It may be congenital. It may be idiopathic. It may be due to lung cancer. For this girl, it is not lung cancer. It may be congenital. Okay, it may be some type of trauma, part trauma in the head and neck region. Okay, and that's all about the anatomy of the cervical part of the sympathetic trunk. Let us summarize again. We have superior, middle, and inferior cervical sympathetic ganglion, and our sympathetic chain of ganglion extend from the base of the skull to the coccyx. The cervical region, we have three cervical sympathetic ganglion. The superior cervical sympathetic ganglion is the largest one. It is against the body of the C2, C3. The level of C6, we have the middle cervical sympathetic ganglion. Inferior cervical sympathetic ganglion is located just in front of the transverse process of C7 to the neck of the first rib. Okay, sympathetic innervation is blocked, then we'll get Horner syndrome. Okay, and that's all about the cervical part of the sympathetic trunk of the head and neck region. Okay, and if you have any question, please feel free to ask me. Please share the information with your friends, and please support my channel. Please subscribe me, and have a nice day. Bye now.